Hello again everyone, this is Joel Pasqua, and for today's video, we are going to discuss a connection to our previous video, which is your acute renal failure. We are going to discuss the second part of renal failure discussion, which is your chronic renal failure. So under this one, we will be tackling now concepts about your chronic renal failure, and hopefully we'll be able to finish until the nursing care. Then afterwards, I'll be able to upload discussions about other management for your renal failure, which is your dialysis, to include your hemodialysis and peritoneal dialysis, plus your renal transplant. So let me go ahead and discuss your chronic renal failure. But before that, please don't forget to subscribe to our channel, and of course, hit that like button, comment, and share this video as well. Chronic renal failure, just like I've mentioned in the previous video on acute renal failure, is comparing to your acute renal failure, which is a reversible condition. Your chronic renal failure is an irreversible condition of progressive damage to the nephrons and glomerulus. So basically, the kidney is really dying and or died and can no longer perform its task to filtrate the blood now and excrete excess byproduct of metabolisms and other electrolytes and fluids in our body or our system. So this is due to several factors, to include nga po your ARF, or the presence of ARF, which is left untreated until it become chronic renal condition. So this condition may lead to retention of waste product, which I've mentioned in the previous discussion, which is your uremia. Okay, and this condition would actually exacerbated or will become worsened, wherein there is too much excessive accumulation of waste products in the blood, which is your termed as your azotemia. Now, the most common cause of your chronic renal failure or chronic renal disease, or CRD, CRF, okay, or chronic kidney failure or kidney disease, is number one, as a complication of your diabetes mellitus nephropathy. So your DM nephropathy, this is one of the major complication and probably the most common cause of death among patients with diabetes mellitus. Okay, so with regards to the pathophysiology of how diabetes mellitus may lead to your kidney failure, we will try to find time to discuss that and relate that to this concept. Okay, hypertension can also be one of the causes, while chronic renal failure can occur, and this is actually the pre-renal acute renal failure until such time it reaches now the condition chronic renal failure if it's left untreated. Glomerulonephritis is also one of the major cause of chronic renal failure, and I do have a video about this one. Just kindly please access it sa ating channel, and we'll try to leave the link also sa ating description box. Okay? And of course, your CLE. I do have also a discussion about your systemic lupus erythematosus, and your systemic lupus erythematosus is a multi-organ dysfunction or a multi-organ failure, wherein it includes now your kidney, leading now to your CRF or chronic kidney. This is renal failure. So these conditions, I will leave the discussion link into our description box in order for you to visit those videos and try to watch them and see how is it related to this chronic renal failure, or to the development of chronic renal failure. Now, your CRF has several stages. So these stages includes number one, diminishing renal reserve volume. This will lead to an asymptomatic condition with no accumulation of waste products. Healthier kidney will now be able to compensate. But once the body isn't able to compensate, okay, it may lead to reduced renal function and a GRF, or glomerular filtration rate, of less than 10 to 30%. So again, the normal GFR, or glomerular filtration rate, is 0.5 ml to, or 0.5 cc or 0.5 ml to 1 cc per minute, which is multiplied by 60 in an hour, which give you the normal urine output of 30 to 60 ml. So a decrease of about 10 to 30% would occur during this stage, and renal impairment occurs. And once a total of GFR 40 to 50% is already happening to the kidney, the kidney is already failing to do its job, which is to filtrate the blood. Okay, until such time it reaches now the stage of renal insufficiency. So renal insufficiency is wherein GFR of 20 to 40% has been already lost. Okay, so hindi na siya less than 1 cc or less than 1 cc to less than 0.5 to 1 cc na ang na-filtrate ng ating kidney, and it will now lead to metabolic waste accumulation, or also known as your azotemia. So basically, this GFR loss of GFR 20 to 40% functioning may lead to decreasing GFR, and the symptoms of renal failure may happen during this stage. So until such time that the end stage renal disease or ESRD had been reached, wherein excessive amounts of metabolic waste has been accumulated, so from uremia to azotemia, okay, ang mangyayari, okay, uremia and life-threatening conditions due to the presence of hyperkalemia or the increased accumulation of potassium in the blood that may lead to cardiac arrhythmias, then eventually death. Okay? Now, what are the assessment findings to patient with CRF? So it affects now multi-organ, okay, multi-organ or multi-system in the body. So let's go by system. Okay, in terms of the signs and symptoms or the assessment findings. Number one there is your GIT or your gastrointestinal tract. In your gastrointestinal tract, once the patient has CRF, patient would start to become nauseated, okay, and also vomits. So meron tayo nausea and vomiting. Stomatitis can also occur stomatitis, which is the inflammation of your mucous membrane, okay, due to the decreasing immune system also of the patient. So it may happens in the mouth through a manifestation of several sores and any type of sores that or yung singaw nga na tinatawag sa ating bibig. Okay? Uremic breath due to the increased accumulation of waste product, meron tayong tinatawag na uremic frost. Okay, uremic breath can also increase, or yung ammonia breath na tinatawag. Diarrhea or an alternating diarrhea and constipation will also occur due to the imbalance of fluids and electrolytes in the body. Okay? Assessment findings in terms of the respiratory system includes your Kussmaul's respiration or breathing. Kussmaul's respiration or breathing is a deep rapid respiration. Okay, deep rapid respiration that is considered as labored breath. So labored breath yung parang naghahabol ng hininga. For example, sa mga nanganganak, okay, labor breath or breathing. So Kussmaul's respiration is due to the high concentration of electrolytes leading to metabolic acidosis. And because of that acidosis, the body is trying to compensate by releasing excess carbon dioxide sa katawan natin to equalize or to maintain state of equilibrium, which is due to the metabolic acidosis. Okay, decreased cough reflex may also occur for patient with kidney failure. For the fluids and electrolytes, hyperkalemia, hypo and hypernatremia, okay, may occur. Hypermagnesemia. So hypo and hypernatremia depends now on the stage of the condition. Okay, in stage of the conditions. If initial stage, nagkakaroon tayo ng hypernatremia, and on the latter stage, when hyperkalemia occurs, hyponatremia will take place. And take note that since patient has hyperkalemia, he is at risk of developing cardiac arrhythmias. You have to monitor the client's or the patient's pulse rate, because that is an important thing that you need to assess to this type of patients. Hypocalcemia may also occur. Just like I've mentioned in the previous video, kidney has something to do with the absorption of calcium from the foods that we eat and from the blood. Therefore, okay, an impaired kidney function would also result to a decrease absorption, okay, of these calcium compounds in the blood and even in the gastrointestinal tract. Okay, and even in the gastrointestinal tract. And of course, the retention of calcium. Okay, since calcium is a water-soluble vitamins, so water-soluble minerals, that's why the excess calcium would actually be uh, excreted through urine, but it can be reabsorbed by the kidney. But since the kidney is no longer functioning well due to its failure to do its function, hypoconcilium will take place. Then you have to monitor for Trousseau sign and Chauveau-Stick sign, which is a classical manifestation of hypocalcemia. Hyperphosphatemia is can also occur. Same thing with your hyperkalemia because these both are intracellular cations. The fluids will now shift from intravascular to intracellular to the movement of solutes will now move from intracellular to intravascular compartments. Okay, for the integumentary system, okay, you would take note pruritus because of the increased accumulation of waste products in the blood, which will now be penetrating now the dermis area through the capillaries. Okay, may lead to pruritus or severe itchiness. Dry skin can also occur, uremic frost, and your edema. Okay, because of the shifting of fluids from intravascular into the interstitial space because of the escape of sodium from intravascular to interstitial, leading now the shifting of fluids or solution from intravascular to interstitial space. Okay, and impaired tissue perfusion. Okay, in the renal area, okay, are the some of the nursing diagnosis that would actually be related or associated with kidney failure, impaired tissue perfusion in terms of renal, excess fluid volume because of the fluid retention, imbalanced nutrition, less than body requirements, and risk for infection are just some of the nursing diagnoses applicable to this type of patient. Activity intolerance can also be applicable due to the fact that the patient may suffer from anemia because of the decreased kidney failure. The kidney is enabled now to produce your hormone erythropoietin that stimulates now the production of blood products. And disturbed body image because of the changes in the integumentary system caused by the high concentration of waste product in the blood. Nursing care includes now maintaining the fluids and electrolyte balance since kidney is the major organ that maintains this electrolyte imbalance. Okay, or electrolyte equilibrium and fluids and electrolyte equilibrium in the body. So kidney is the main organ responsible in maintaining that. Monitor vital signs. You have to monitor vital signs, specifically your pulse rate if the patient is hyperkalemic. Intake and output, you also need to monitor the vital signs of the patient. Blood pressure is also be monitored. But among the two, vital signs versus your hypertension versus your pulse rate po ang ating priority because of the hyperkalemia. Okay? And weigh the patient, of course. Assess presence of extent of edema, auscultate breath sounds. This is for assessing possible pulmonary edema. Okay. Encouraged to remain within prescribed diet, percentage fluid restriction, very low protein, which is less than or not about exceeding 20 grams per day. So prescribed diet, fluid restriction is the same diet for acute renal failure. It has to be high caloric diet, low protein and low potassium foods or low potassium foods such as your avoid or prevent or minimize consumption of banana, apple, cantaloupe, and other fruit products. Okay, administer also phosphate, which is a binding agent for amphigyl. This is to um, manage the condition in your kidney, which is leading to your metabolic acidosis. Also prevent injury and infection since the patient is immunocompromised. You have to maintain a meticulous skincare because of the pruritus. Maglilid ito sa impaired skin integrity causing now infection to the skin if left untreated. Encourage activity but avoid fatigue since the patient is anemic. There is a possible activity intolerance due to increased oxygen demand. Protect from exposure to infectious agent because of the decreased immune system. Avoid also aspirin because it may lead to further bleeding since the patient is unable to produce more blood components. Use soft toothbrush. This is to prevent gum bleedings that may lead to possible hemorrhage sa ating gastrointestinal tract. Promote comfort to this patient. If they are febrile, then you have to treat them with analgesics unless it's contraindicated. And due to severe itchiness, you may also read to give antipruritic agents, okay, unless it is contraindicated. So make sure that this is a doctor's order before you give it, and of course, double check if this is something that the patient is allergic into. Okay, the patient may also need to assist with coping and lifestyle and self concept. So since your chronic kidney failure is basically a lifestyle related disease, okay, and they have to still find their worth even with their situation, and that's the time that you're going to assess also the psychosocial status of the patient, and of course provide interventions if necessary. Promote hope, provide opportunity to express feelings, always should be there. Okay, whenever the patient needs you. Identify available community resources that may help the patient, including family support. Prepare client for dialysis or kidney transplant. For your dialysis and kidney transplant, it can either be your peritoneal dialysis and your hemodialysis. And for kidney transplant, that is for your transplant of kidney from a source, either it's a living source or a non-living source. And we'll try to discuss that in the next videos that we'll try to upload, still related to your chronic and acute renal failure. If you do have any question, guys, please don't forget to comment down sa ating comment section. And of course, hit the like button, comment, and share this videos. Thank you very much for listening, and I hope to see you on my next video. Bye for now.